Well, welcome, folks. I'd like to welcome you to our Academy of Glengarry Multimedia Studio. And today we're here with a very special guest, Larry Allen, who is the Chief Operating Officer at Central Florida Behavioral Health Network. He's a very close friend of ours, and he was actually with us, Larry, 6 years ago when the dreaming and the planning process of the Academy started. So Larry is back to visit with us today, and so we're taking advantage to invite him in here to our studio to share a little bit of the history and the why behind the creation of the Academy. So Larry, welcome to Academy of Glengarry.
Oh, thank you for having me. I'm very happy to be here.
It's great to have you back. It's great to have you back. It's been a while, but I know you've been following us in our development. You've been here off and on as we've built the facility and established our program. So thanks again for making the trip down from Tampa, from your offices.
My pleasure.
So Larry, I wonder if we might talk just a little bit about Central Florida Behavioral Health Network. What is your mission? What is your role here in Sarasota and on the Gulf Coast of Florida?
Central Florida Behavioral Health Network is the managing entity. We're established in Florida statute, and Central Florida is tasked with taking all of the DCF federal and state dollars from the Department of Children and Families and using those to fund services for behavioral health, substance abuse, and mental health for the poor or the indigent, people who don't have access to services. That's in the 14 counties on the west coast of Florida. We go down to Collier and then up to Pasco and then over to Polk, Hendry, Hardy, Glades counties.
So you all are busy.
Very busy. We're road warriors in a lot of ways.
Well, you do a great job, and without Central Florida Behavioral Health Network, we would not be here right now. So your specific role, could you share a little bit about what your duties are?
Sure. I'm the Chief Operating Officer, so I'm in charge of all the operations at Central Florida. That includes quality improvement, risk management, IT. I also have the Community and Family Affairs Department and the community and housing staff that we have that work throughout the region. Mm-hmm. It's a big job, lots of varied kind of lots of work that I do every day. So I can be talking about a program-specific issue with quality or risk management, and then up to a very high systematic kind of philosophical discussion about how we're going to roll out services or what critical things we see.
Yeah. And so Central Florida provides funding to nonprofits across the 14 counties. How many different providers, how many different human service agencies do you all support? Do you have a number on that?
I do. It changes day to day, but right now we're at 62, and all not-for-profits, and Central Florida is a not-for-profit. And then we fund everything from children's services to adults, mental health and substance abuse, and also prevention services for substance use disorders.
Yeah. Well, that's quite a few providers to keep track of. And what I've always appreciated about Central Florida, and also your boss, Linda McKinnon, you all are always available. If we need something, we can pick up the phone, we can write an email, and I think customer service is top of your list. So we appreciate that.
Yeah, that's critical because we see the work that we do with our communities as the most important thing that we do. So we can help families when they have specific issues of getting into services. We work with providers when there's a billing issue or a data issue. I deal a lot with those. It could be a large system-wide issue, or it could be a very minute, in-the-weeds kind of issue with providers. And we tend to work or want to work in customer service is critical.
Right, and
I'm glad to hear you've had good experience with
it. It's you have a great team there, and I'm so appreciative of the responsiveness. And I think maybe part of that is a lot of the workers, a lot of the staff at Central Florida have been or are social workers, therapists, have done direct service, so you know what it's like on this side.
Yeah, everyone on the senior leadership team, there are 4 chiefs. There's a chief clinical officer, the CEO and president, me, the COO, and the CFO. Three of the 4 of us have clinical degrees.
Yeah.
So we're licensed mental health professionals. We're behavioral health professionals. So we understand from a program standpoint what needs to happen, and we have a good understanding also from the business side of how we need to implement programs and get funding and to make the operation work, because it doesn't work without money. but you also have to be accountable to how those dollars are spent and where they're being spent. So we've developed a system that we're able to answer questions to not only our own internal auditors, but to the Department of Children and Families, to counties, and to our own board and committees within the communities.
Well, thank you. And again, we're very appreciative, and that's why it's just a pleasure to have you here today, Larry. And at the beginning, I mentioned we wouldn't be here without Central Florida Behavioral Health Network, and certainly we wouldn't be here without your role in helping to plan and dream this beautiful project, which is the Academy of Glengarry. So I'm going to ask our multimedia team, I want to go back a few years before the Academy existed and talk a little bit about the creation of our public-private partnership. And I think that concept at the time was a little new to us here as we were developing the project, but it turned out to be a key to our success and a key to us developing a quality program that really meets local needs, that wasn't designed in a different county or a different state. It was really designed and constructed here for the needs in the Sarasota community. So could I have a photo? I don't think Larry will remember this photo. Well, maybe you will. But
I remember that.
Do you remember the land? So this is 5 years ago.
I remember the conversation of trying to save a tree, and they said, no, we can't.
Yeah, so for our viewers, this is the property that the Academy now stands on. These were 5 different individual lots, and as Larry mentioned, there were trees right in the middle. We're actually sitting probably about where those trees are right now, inside the Academy, and apparently those trees were sick, and so they were able to be taken down, and we had to plant other trees in their place. But take us back 5 years. Let's talk a little bit about the concept of creating a Clubhouse program here in Sarasota. How did that come about? I know that there's not a lot of new money for mental health projects. So what was it like on your side, on the side of Central Florida Behavioral Health Network?
Well, I'm going to go back a little further to the first meeting that we had. And you presented this idea to me and to Michael Krause, who was our director of contracts at the time. And when we met, and you talked about who you were bringing to the table, that there were people in the community who wanted to come up to help fund the Geyers particularly, who wanted to step up to help with the building. You needed operational dollars. State funding doesn't allow bricks and mortar, so we couldn't fund that. After that meeting, you talked about what the Academy was going to be and the importance of recovery through work and all of the benefits that it would bring to the community. You and Peter Howard left, and Mike Krause and I looked at each other across the table and said, how can we not fund this? We need to find a way. And so we then presented it to our boss, Linda McKinnon, and she supported it 100%. And then we started going through the books to figure out how we could make it all work. And it took some time, but I have to say, too, the Department of Children and Families, when we presented the idea to them, to the Assistant Secretary, and then ultimately to the Secretary of the Department of Children and Families, they were 100% behind it. It was a public-private partnership where the state can't do everything. The state can fund, and through Central Florida, a part of the operations, but we can't build buildings, and we have to have the support of the community. Well, the pieces came together to make that happen. Not only that, but now it's becoming a model. We have a couple of other programs that we're trying to get off the ground around housing, additional clubhouses, and some services that we're using the public-private partnership model to say if the community is really interested in this, we have to get the people in the community there to help build it. And so that's happening. And it's a different kind of model in different counties. Sometimes the counties step up. Sometimes it's private donors. It just depends on the county. It could be other companies stepping in. So, but the model is there, it's critical, and it is supported. And it's a way that I think we can expand services rather than at the Central Florida level, us always going back to the state. It gives another avenue of funding that's really critical.
And I'm guessing from your point of view, you have a limited amount of dollars. So if you're able to create public-private partnerships, you can make those dollars, you can stretch those dollars into more programs if you have also resources that are being devoted from the community. And it's also digging roots to the success of that program into the community.
Yeah, I think that's an important point. The community, when it's involved from the outset, they're invested in the success of the operation, in this case, the academy and the clubhouse. But that investment is really important because it's just partly getting people to know that you're there, and so that you can bring different partners to the table. I know here it just kind of grew, and then somebody else was brought in to help with the kitchen, and then somebody else was brought in to do different projects around. I remember when this was just a dream, and as you said, we're sitting where those trees were, but I saw it being built also. So I remember this particular room when it was concrete and there were no walls. And I think it's really exciting to see a project grow from the ground up, literally, but to bring together those community partners. And we have a large contract, but it's not enough to meet the needs of people in the 14 counties that we serve. And we have to find ways to develop projects that, first off, meet the needs of the community, meet the needs of those individuals who would benefit who have behavioral health issues, and to integrate it into the community, into the fabric of the community. I think all those things are really, really important.
Yeah. Well, our partnership, the public partnership with Central Florida Behavioral Health Network, has been crucial to us because it gives us a foundation to build on. It gives us the support that we need, all kinds of support that is available to us. So it's been crucial to our success, and I think the local support, they want to know that the state's involved, but they also realize that right now, fortunately, the support from Central Florida covers about a third of our budget, which helps our local supporters realize, well, we need to do 2/3, and we can do that. And so it's just been a nice partnership, and it allows us to develop in ways that allow us to pursue quality. Did you ever, so at this stage with an empty plot of land, what's it like now for you to visit and see this facility and see what was actually built?
I send people here to look at what is possible. And I think that's critical. So I say, if you want to see what you can do with a public-private partnership, go to the Academy in Sarasota. That's what's possible. So take that as the goal.
That's nice.
And people have done that. They've come down and they've toured and they've looked at it and said, this is what we want. And I think that's really important. I think also one of the things a value that we add is we work together to figure out how to fund it. Because it wasn't at the beginning, it wasn't the typical funding. So we had to make sure that we were accountable, not only the Academy, but also Central Florida, that the dollars were being used as they're intended, but there is some leeway in that. So we worked with you, and we continue to work with providers, but also the partnerships among the agencies, because the Academy started out with Centerstone as their fiscal agent, which I think was a big help to you. Now you've moved beyond that, but it's because we can help develop those partnerships and expertise where you don't have to have it all in-house, and then working together.
Yeah, as a small organization, it's nice to count on other resources so that we can spend our time doing our job here with our members.
Yeah, which is serving members and serving the community. Exactly.
Right. Well, that's great. I wonder, as we think about wrapping up, and this has been great to have you here, what is the role of International Clubhouse? We're accredited by Clubhouse International. What's the role of clubhouses in mental health here with Central Florida in the continuum of care? Why is this important? Because as you know, we don't do clinical services and supports. I guess I'm ultimately asking, why is work important? When
I was going through and getting my MSW, there wasn't a real focus on people that I worked with who had serious and persistent mental illness or serious substance use disorders to find work. That wasn't a focus at that time, at least in my education. But I think it's critical because we don't even talk about it as Clubhouse. We call it Recovery Through Work programs. And I've always loved what I've done. I see some days it's difficult, but I still love it.
Work is important to us, right?
But it's very important, and if it's important to me, it's important to everyone. And so how do we help create environments where people can recover through work and then move towards financial stability, having safe and secure housing, but being able to take responsibility for their own lives as they're able to do that with the support of the community. And I think that's the importance of recovery through work programs. I do also, you reminded me of something, is that one of the values the Academy brings is being accredited, because that gives a standard that lets the state know, the Department of Children and Families and Central Florida know, yeah, you're meeting basic standards of this accreditation. That is critical. We require that our agencies that we subcontract with are accredited. Central Florida is accredited. And we see that as a valuable partnership with an outside organization that's coming in and saying, yeah, you're doing what you need to do.
Oh, that's great. I guess my last question is about our members. We have 4 members here that are helping with this recording right now. Ultimately, this whole project is all about helping people move forward. It's about our members. What message might you share with our members about your visit with us today, or about their future, or what the possibilities are?
That's it, possibilities. Is that it's a place where people can come and explore. Even when they're afraid, they're not sure, there are people who can support them through every single level. And it's a place of healing. It always feels good when I come here. And so what I would say to members is, those who are struggling, hang in there. Those who are successful, help those that aren't and are struggling. And to family members, keep supporting. Love is the most important thing that they can give to family members, and their support.
Well, Larry, it's been a pleasure having you here in the studio. It's always a pleasure to have you in our building. You're always welcome here.
Thank you.
You know that. And on behalf of the entire Academy, thank you for dreaming with us 6 years ago. Thank you for doing the hard work of helping us figure out this public-private partnership. And as we move forward, let's enjoy the opportunities together. So thank you, Larry.
You're very welcome. Thank you for having me.